Welcome to the introductory video about EvidenceNOW Southwest. This is a very important project, both for practices and for people working to support practices and quality improvement. EvidenceNOW is a national AHRQ grant initiative dedicated to helping small and medium-sized primary care practices across the country use the latest evidence to improve the heart health of millions of Americans. This initiative aligns with the U.S. Department of Health and Human Services Million Hearts, which is a national effort to prevent 1 million heart attacks and strokes. The overarching goal of EvidenceNOW is to improve the delivery of heart health care at over 1,500 primary care practices across the country. Our goal is that each of these practices will meet the national target of 70% of all patients adopting the ABCSs of heart disease prevention: aspirin use by high-risk individuals, blood pressure control, cholesterol management, and smoking cessation. We're focusing on cardiovascular disease because heart disease causes 1 in every 4 deaths in the U.S. It's the leading cause of death for both men and women. Americans have 735,000 heart attacks every year. Stroke is the 5th leading cause of death in the U.S., and 80% of those strokes could have been prevented. Stroke is the leading cause of adult disability in the U.S. However, there's more that we hope to accomplish. Our second goal is to understand what types of supports help primary care practices achieve these improved health outcomes. Local and national evaluations will study how best to deliver new patient-centered outcomes research to primary care practices and how to assist practices in using the research to deliver care to their patients. EvidenceNOW will create a blueprint of how our nation can build a primary care system that delivers high-quality, patient-centered health care for everyone. EvidenceNOW established 7 regional cooperatives composed of public and private health partnerships and multidisciplinary teams of experts. Each cooperative is recruiting and engaging 250 to 300 small and medium-sized primary care practices. The cooperatives then provide targeted support services to practices enrolled in the initiative. The EvidenceNOW Southwest cooperative is one of those 7 regional groups across the country. Through a partnership between the University of Colorado Denver and the University of New Mexico Health Sciences Center, our 2 states will work together to serve at least 250 small to medium-sized practices, assisting them with improving cardiovascular risk, as well as assisting with quality improvement and health information technology. As you can see, there are many partnerships involved in this massive project. Here in New Mexico alone, we have a comprehensive team that spans the entire state. Our team consists of the UNM Health Sciences Center Office for Community Health and the Department of Family and Community Medicine, which provide the backbone support and administrative services that are needed for a project of this magnitude. The UNM Office for Community Health developed Health Extension Rural Offices, or HERO for short, as a vehicle for its model of health extension, which offers the academic health center methodologies for community engagement that can address the social determinants of health. These HEROs are located in rural communities across the state and work with different sectors of the community to identify high-priority health needs and link those needs with university resources in education, clinical service, and research. The Southwest Center for Health Innovation is a nonprofit organization focusing on community health. Health Insight New Mexico is a private nonprofit community-based organization dedicated to improving health and healthcare. The New Mexico Primary Care Association promotes the advancement of high-quality primary healthcare services. Team-based care, where at least 2 health professionals work collaboratively along with patients, family caregivers, and community on shared goals within and across settings, is widely accepted as an effective methodology to achieve care that is safe, effective, patient-centered, timely, efficient, and equitable. While we're used to this concept as it applies to patients, we are also providing this type of support to clinics, with support from a team of facilitators. Each clinic that participates in this initiative will have access to what we lovingly call the tripod team. The name comes from the fact that there are 3 different roles that will assist the clinics in achieving their quality improvement goals. The role of practice facilitator is to coach for quality and process improvement, keep the team on task, identify and solve problems, implement sound quality improvement techniques, and link clinics to quality improvement resources. The role of the clinical HIT advisors, also called CHITAs, is to support practices' data capacity, analyze and identify potential improvements in practice data systems, and assist in developing and managing workflow for data collection, reporting, and analysis. The role of the HERO is as a local community health improvement professional that builds ongoing supportive relationships with the practice. Heroes connect practices with public health agency and community resources to meet their needs, collaborate with practices and community partners to identify and assist with community health priorities and address social determinants of health. This tripod team of the facilitator, cheetah, and hero work together with practices, sometimes meeting together and sometimes meeting separately, to meet their cardiovascular improvement goals. There are a lot of benefits to practices for participating in EvidenceNOW Southwest. For example, through practice coaching, you will receive practice facilitation through communication, be it virtual, electronic, or in person, with your tripod team to assess progress with your goals. You'll also receive assistance with your electronic health record via data resources and technical support, system-level engagement as needed, as well as baseline assessment with feedback. There's also access to maintenance of certification and free CME credits. The latest evidence-based information will be delivered through learning collaboratives, which are also a way to participate in a statewide learning community, as well as through training resources for clinicians and staff, through e-learning modules, webinars, and even an online toolkit. Through expert coaching and access to local health extension, you'll be connected with community resources. All of this is provided at no cost to the practice, and there's even a small stipend for practices for participation in the research part of the project, which is available after the completion of a few surveys. As a practice, what is expected on your end as active participation in EvidenceNOW Southwest is to identify a group of staff and/or clinicians to work with the EvidenceNOW tripod team and receive 9 months of support. You'll need to report on the 4 clinical quality measures, ABCSs, aspirin use, blood pressure control, cholesterol treatment, smoking cessation. There'll also be surveys at baseline, 9 months, and 15 months. This includes the practice survey, which is 1 per clinic site, as well as a practice member surveys. So everyone in the practice, clinicians, staff, should complete this survey, and we hope that at least 70% of the members of a practice will complete it. You're also encouraged to attend at least 2 learning collaborative sessions. These are all-day in-person conferences that will take place across the state. They're also known as peer learning workshops. At least 1 person from the practice is encouraged to attend, but you may send as many as you wish. Travel and lodging will be covered by the project. The million-dollar question is, how will we know if this project was successful? How will we know if it worked? As we mentioned before, EvidenceNOW is part of a national AHRQ initiative, and all 7 collaboratives across the country will be collecting the same clinical quality measures, or CQMs, related to cardiovascular disease. These measures were chosen by a national evaluation team and include measures that most EHRs can already calculate. However, in some cases, the CQMs may not exactly mirror the latest guidelines that your practice is implementing. You and your tripod team will work on what goals to set for your specific practice, and all practices involved in EvidenceNOW across the country will upload the following measures so that we can track progress on improving cardiovascular outcomes. You'll notice that 3 of the 4 measures are identical to the PQRS, NQF, and CMS reporting requirements listed on the right. The cholesterol measure, unfortunately, is not. So capturing and reporting the clinical quality measures we're using to measure the effect of EvidenceNOW Southwest may cause an increase in CVD risk, or at least a headache, especially for your clinical HIT advisors. However, the process should help make enrolled practices better equipped to report on these and other measures as part of their current and future reporting requirements. There are many resources available to you as part of this project, both here in New Mexico as well as in Colorado, so please reach out to your tripod team or to us directly with any questions or concerns. If you do have any questions or concerns, please send them to evidencenowsouthwest@salud.unm.edu, abbreviated as ensw@salud.unm.edu, and we'll get back to you as soon as we can with any responses, any referrals to more information, access to other doctors who might be able to provide more specific clinical information, access to members of your tripod team, or access to resources in our partner state of Colorado. Thank you so much for your time.